Hi, and welcome to another episode of Surrendered Birth Stories. Birth stories, birth education, and the pursuit of surrendering it all to God. Let's get started. Did you know there are multiple options to choose from when it comes to picking out a care provider for your pregnancy and birth? Today, I have Kristian Jordan, a local birth professional, to discuss the different care providers we have available to us during our prenatal and postpartum experiences, and why you might lean toward choosing one over another, depending on your specific circumstances, wants, and needs. Welcome to another episode of Surrendered Birth Stories. Today, we aren't doing a birth story. We are doing a birth topic, which I'm really excited about. And I have on Kristian Jordan, a local birth worker in the area, to help us talk about how to choose a care provider for your pregnancy. So, Kristian, if you could just start off with introducing yourself and telling us about who you are and what you do, that would be great.
Awesome. Thanks for having me on. My name is Kristian Jordan. I am a local birth doula. I've been a birth doula for about 6 years since the birth of my son in 2017. And I have a local business in the Triad area of North Carolina called Holistic Heritage Birth Services. I have 4 other doulas that work alongside me. And outside of birth doula services, we also offer postpartum doula services, childbirth education, birth tub rentals, birth photography, placenta encapsulation, postpartum meal prep services, and a few other things.
Awesome. Like a one-stop shop.
One-stop shop. Exactly. Exactly.
Okay, so today we are going to talk about choosing a care provider because if any listeners out there are like I was when I got pregnant for the first time, I didn't realize there were choices.
Mhm.
I always just thought, you get pregnant, you see an OBGYN, you deliver at a hospital, and that's what you do. So, can you just begin by telling us what the different choices are and maybe what some of the major, like, big picture differences are between them?
So, speaking specifically right now about hospital birth providers, your choices are certified nurse midwives and obstetricians, so OBGYNs in the hospital setting. And that's specifically in North Carolina. I do know in other states that other types of midwives are sometimes allowed to practice in hospitals, but this is just speaking to North Carolina. So, one of the biggest differences is, how these providers view birth. So, and what they're trained to do. So, midwives are trained in more physiological birth settings. Sometimes they participate in water birth. And then obstetricians are trained more on the medical side of birth and sort of um, treating birth as a health scenario, and also they're very skilled surgeons. So if you need a C-section, an obstetrician is who you want to be seeing.
Okay, so that is for if you're choosing to give birth in a hospital. What if you want to have a birth center birth? What if you want to
Yeah.
deliver in a birth center?
So in birth centers, certified nurse midwives are the care providers in those in North Carolina.
Gotcha.
Um,
So same type of midwife who would be in the hospital, but just at the
Outside of
freestanding
that.
birth center.
Yes. Yeah.
Gotcha. So then if you want to have a home birth, what are your choices then?
Yeah. So with home birth, I know of no obstetricians that attend home births. It's always midwives. But in the home birth setting, you have different kinds of midwives. So there's the certified nurse midwives, like the ones that practice in birth centers and hospitals. We do have quite a few of them in North Carolina who have home birth practices. And then beyond them, you have certified professional midwives or CPMs. And basically, the difference is the type of training that those midwives have received. So, certified nurse midwives have gone to nursing school first, and then have served as an RN for at least 2 years in hospital setting. And then they've gone back to midwifery school to add on their certified nurse midwife track. And that's what, they go through to become a midwife at that point. So they've been a nurse and then they become a midwife. A certified professional midwife, there's different routes that people can take to get that certification. A lot of it is apprenticeship, and a lot of that is training outside of hospital settings, so at home births and in birth centers. And you don't go to nursing school first. You're basically going straight through the midwifery track of that. You're still learning most of the things that nurses learn. You're just not becoming an RN first.
Gotcha.
Also for home birth, there are some, lay midwives or traditional midwives that attend home births. Those are the midwives who don't have been not gone through a certification program, but they've learned under other midwives in their community. So, really just kind of like the old school traditional community midwives.
Okay. Now, we live in North Carolina,
Mhm.
and most of our listeners do as well. North Carolina, I get this question a lot. Well, isn't home birth illegal in North Carolina? I get I get that pretty frequently,
I get that question
and
a lot too.
let's clear that up right
Okay.
here because really it's not illegal. First of all, so we'll say that, but what are they confusing that with?
So it is never illegal for you as the birthing mom to have a home birth. You can have a home birth anytime you want. You can have a home birth assisted, unassisted. It's never illegal for you. What makes it illegal for someone is the midwife that is attending. So in North Carolina specifically, only certified nurse midwives are viewed as legal midwives in this state. So the certified nurse midwives that are attending home births are doing so legally here. So they could not get in trouble for attending your home birth. Otherwise, if you get a CPM, a certified professional midwife, or even a lay midwife or a traditional midwife here in North Carolina, it is technically illegal for them to attend your home birth. So, still not anything that's illegal for you, but is illegal for them. There are still quite a few CPMs that practice and have home birth businesses in North Carolina. And it's very interesting. It's a very unique state because all of the surrounding states around North Carolina are legal for CPMs to attend home births. So we just seem to be like that little holdout state that can't get laws passed to make it legal for CPMs to attend births. But there are still CPMs who will attend.
Right. You'd be surprised just how many babies are born at home in North Carolina under the care of a CPN.
Yes.
Yes. And a lot of them are licensed in the surrounding states and
Yep.
sometimes they just provide care to people in both states.
Yep. Exactly.
Okay. So I'm pregnant for the first time. I am trying to. Oh, okay. I didn't know that I had choices. Okay. So let's go into these choices more. What would be like a factor in wanting to choose an OBGYN? Like, what would make me want to choose the route of seeing an obstetrician, which would mean I would be delivering in the hospital? Like, what would be some things that would make me want to choose an OB?
I think a lot of it depends on your philosophy around birth. If you are someone who really wants very, very managed care, an obstetrician might be the right route for you to take with your care. If you know from the very beginning of pregnancy that you have a very high risk pregnancy, especially with a high likelihood of a C section, then going with an obstetrician from the beginning of pregnancy might be a good choice for you. Otherwise, if you believe in physiological birth and you're low risk and you don't want your care to be so micromanaged, you don't want to be looked at as a hospital case of somebody that's sick that needs like very managed care. Like if you want to just go into the hospital setting and do your thing and have maybe a natural birth without interventions, then a midwife would be more in line with what you're looking for.
Okay, so what if I want an epidural? Do I have to have an OBGYN or can I still have a midwife?
Absolutely can still have a midwife. And many midwives can manage more higher risk pregnancies in the hospital setting. So when my pregnancy turned into preeclampsia with my first, I still had a midwife in the hospital to help deliver my son. And I have been a doula for many clients who have higher risk pregnancies, and a midwife was very much still able to manage their care because at hospitals, there's always obstetricians on staff on call. And so if a birth turns emergent to the point of needing a C-section, there's always an OB that is there for that C-section if it's needed. So if midwifery care seems to be something that's more in line with your views on birth, then most of the time you can still find a midwife in a hospital.
So let's say that I'm trying to decide now, okay, I'm not a high risk, I'm a low risk. I don't really know what kind of birth I want to have exactly, but I'm leaning towards a natural birth. What would make me choose a midwife in a birth center or home versus a midwife in the hospital? Like, if I want a natural birth and I know a midwife, not that you can't have a natural birth with an OB, but since midwives are trained more in physiological birth, what then would be like a deciding factor between like which midwife to go with?
Yeah, that's a great question. I mean, I think one of the things is if you still want the option of pain medication or an epidural, then having a connection to the hospital is probably your best option for you personally. So, in the case of a client who was open to an epidural but still wanting to go for a natural birth, I might would recommend a hospital-based midwife or even a birth center midwife because then they could always transfer to the hospital if they decided at some point in labor they wanted to get something for the pain.
So, okay, so let's say I don't want an epidural
Yes.
and I want a totally natural birth. And I'm doing all the things, I'm doing all the research, I'm taking care of myself, I'm preparing for birth, I'm taking classes, I'm reading books, I am getting ready for this natural birth. Then what midwife would you recommend?
Yeah. So it's very hard in North Carolina to find home birth midwives, mostly because a lot of them are not certified nurse midwives here. And so they don't just, you can't just Google home birth midwives and end up with this long list of people to contact. So, one of my biggest suggestions is to reach out to a local doula and sort of get established with a doula. And doulas always should always have great recommendations for local home birth midwives. They usually are much more connected in the community and into the birth world and should have a list to give you of all different kinds of midwives and sort of have like the ins and outs of the local midwives. And in North Carolina specifically, we have a Facebook group called North Carolina home birth community, something like that. So I would imagine that if you were in a different state, you could probably connect in that way to find home birth midwives as well.
So, let's clarify real quick, only because I'm just trying to like put myself in the seat of someone who's pregnant for the first time or brand new to the birth world and really doesn't know or have any kind of background knowledge. Before I had a baby, I had no idea what the difference between a doula and a midwife was.
Yeah,
I kind of thought they were the same thing. So
great question.
you're saying to reach out to your local doula. I'm like, well, isn't that
The
the same
same
thing
thing.
as a midwife?
Yes. Yeah. So no, it's not. So a midwife is a care provider. So a medical care provider, just like an obstetrician, they are the ones who are looking at the health of you and your baby during your pregnancy, birth, and postpartum. They are the ones who are doing your prenatal appointments. They're checking your vitals, they're checking your baby's heart rate, they're making sure your baby's growing well, all those kinds of things. And then when you give birth in in your home or birth center or hospital, they're the ones who are actually going to be there still taking your vitals, checking your baby's heart rate to make sure your baby's tolerating labor well. If you get cervical exams, they are the ones that are going to be doing those. So they're handling all of the physical, medical health parts of your birth. A doula, on the other hand, is more for emotional, physical, spiritual, and educational support. So, a doula is somebody who walks alongside you in your pregnancy, birth, and postpartum, sort of holds your hand along the way, offers education to you as you're navigating decision making during your pregnancy. They can help you with your decision making when it comes to care providers and navigating that, what questions to ask your care providers. And during your birth, they're making suggestions of position changes, ways to progress labor, offering things like counter pressure and massage and that kind of physical support, words of affirmation. And then postpartum, they're offering suggestions of things for other resources, some basic lactation support doulas usually offer. And then their doulas are very good at recognizing if something needs an additional resource postpartum as well.
Yes. I've heard it many a time, and I pretty much agree with this analogy that your doula is like your labor coach almost, but also almost say like when you have a wedding coordinator and you're like planning a wedding and they're the ones who are going to help you figure out all the details and then be there the day of to help everything run smoothly. And it's kind of like that for your birth. Like they're just like that extra point person and who can be there for, yeah, like all the purposes that you said.
Yes, and I will add in there that doulas don't generally talk to your care providers on your behalf, but they can help facilitate good communication between you and your care provider. So in the situation of birth, you know, if the care provider brings up something that the doula knows is not something that the client wanted or had planned for, doulas are really good at advocating in the sense of bringing awareness to the topic, asking good questions for the client, and then helping the clients to sort of navigate that decision making. So we don't make decisions for the clients. We don't talk to the care provider and tell them what the client wants, but we just really help open up that communication and hold space for that to happen.
Yes. Okay. So say I'm planning an epidural and so I'm planning a hospital birth and maybe I have some sort of high risk issue. I have maybe like type 1 diabetes or something. What are my appointments going to look like with an OB? What is a typical standard OB's schedule like appointment wise throughout the pregnancy, and what might those appointments look like?
Yeah. So you asked me that at a very good time because just a couple of weeks ago, I actually attended an appointment with a client. Um, and she was in an office that has obstetricians and midwives. So while she was waiting for her appointment with her midwife, we were able to observe how many clients or how many patients an OB saw versus how many patients a midwife saw for just a regular prenatal appointment. And in the time that a midwife took with one patient, excuse me, the OB saw 3 different patients. She just had people in and out of the room so quickly, it seemed so rushed, and who knows what they talked about during their prenatal appointments with each other, but it seemed so rushed, and it was just so interesting to me that the midwife was in there that whole time with one other patient, and so you know that there was just more communication going on, more questions being answered, and the appointment not being rushed and it being as long as the patient needed it to be. And so just seeing that, observing that, because I've never been seen by an obstetrician before in that setting. And I've only been a patient of midwives before. So I've always had that more personalized care. And so imagining being in that scenario of feeling rushed through an appointment makes me so sad. That is a standard for a lot of people, and that is the kind of care that a lot of moms are getting, and not knowing that there's different kinds of care if they prefer that.
Yeah, so I can just speak anecdotally because I have seen an OB for pregnancy. I've seen a birth center midwife for pregnancy. I've seen home birth midwife for pregnancy, and I have been to several CNM, like certified nurse midwife hospital, who work in hospitals with clients, just like you were going with your client. I have been to several with them. So I have really seen the variety. And I will say for an OB visit, the schedule is pretty much the same across the board in terms of how often you go. Like typically you're going once a month. And then when you hit like 28 weeks, you're going twice a month. And then when you hit, I think 36 weeks, you're going every week, except at a birth center or home birth, they won't make you go every week until you hit 40 weeks typically. But with an OB, it was a lot of waiting in the waiting room. And then you would get shuffled to go pee in a cup, and get your weight checked and all that stuff. And then you would sit in another waiting room that was like a back waiting room and wait and wait and wait and wait some more. And then you would go see, you would go in the room and wait in the room um, for some more time. And then the OB would come in. And depending on who your OB was, there were appointments that I had where the OB never lifted their face from the clipboard,
Oh my goodness.
like where they were looking down the whole time. Especially when you're going through the rotation at the end, because at an OB office, um, there's typically 5, 6, 7, 8, 9, 10, 11, 12 OBs in the office that you're rotating between. So because they always want to say you don't know who's going to be on call when you deliver. So they kind of want you to meet everyone. But at the same time, like
You're not actually meeting.
you're not meeting them. Like you're seeing their face once, but you're not developing a relationship with them by any means. And you may not even get through all of them by the end of your pregnancy. But it's very quick and very like, okay, here's the baby's heartbeat. Sounds fine. Do you have any questions? And the do you have any questions, I feel like is a more of a like a I'm about to leave the room. This is my goodbye.
You don't have any
And
questions, do you?
you don't have any questions, all right? um and if you do, it's like they almost don't know what to do with it sometimes, or they're very quick to give you just like a very appeasing answer. But to their defense, they are slammed.
Yeah.
Like they get booked appointments back to back to back to back, like you saw. They don't really have time in their schedule to attend to your questions and your needs and all of that. And this is generally speaking. Obviously, I'm sure there are OBs out there who are much more attentive or maybe have longer appointments, but I don't think any of my OB appointments during my pregnancy lasted more than 10 minutes.
Like, once you were in the room with
Once
the
I was in the room with
yeah.
the OB talking to them, like there's no way any of them lasted more than 10 minutes. Um, and then I'll go to the next step, which I would consider like a certified nurse midwife who works in a hospital.
Mhm.
So they also usually are at practices with multiple midwives who you would rotate between, but usually not as many midwives as the OBs. So maybe like 3 to 5 instead of like, 8 to 12.
Mhm.
So um, the waiting game is similar with the waiting room and peeing in a cup and then another waiting room and then waiting again in the actual clinical setting. But once the midwife gets in there, they sit down, first of all. That's the
Yeah.
difference. The OBs usually don't sit down, they just stay standing. But the midwives will sit down and it just seems slower paced. Like
Mhm.
it just seems like they're more interested in you.
As a whole.
They're looking at you.
Yeah.
So that's helpful. And they remember you because there's less of them. So you've seen them more often. You're getting to know them. So it's just, a little bit different of an experience.
Mhm.
You're in the same type of room that you would be if you were with an OB, but just you're seeing the midwife and there's usually not a feeling of rushing going on. There's no like being rushed out the door or I have to go, so we need to end this. Like they really allow you to get all your questions out.
Yeah.
And then at a birth center, which I had for two of my pregnancies, um, what I thought was cool was like they just took it to another level where the room that I would meet them in did not look like a clinical setting room. Like there was like a couch on the floor and I was usually
Feels a little more homey.
yeah, it's more homey. There's no fluorescent lighting. There's lamps like there are clinical cabinets in there should they need something, but like it just feels like a different environment. It feels like you're sitting in someone's little home office or den or something, having this super personable conversation. And typically, they're not just asking about you, they're asking about your kids and about, you know, how's your husband? Like they're getting to know kind of like your whole family and your whole self rather than just you and your pregnancy.
Right. And if I can interject there, with OB offices, sometimes they're okay with you bringing like your kids to an ultrasound, but generally speaking, it's usually just you and your significant
Spouse.
other, yeah, your spouse. But in a birth center setting, they are more open to your family, it being like a family kind of experience if that's what you want it to be.
Right, like, you can bring all of your kids
Yeah.
to all of your appointments if you want. I've seen, the lady at the desk at the birth center holding toddlers or playing with babies, like, while their moms are in the appointment so they can focus, and they usually have, like, a big, playroom area for the little kids, and so it's like,
It's more family friendly for sure.
definitely.
Yeah.
And then home birth midwives. Now, some of them will have you go to their house or their office for your visits, but some of them will come to your house, which was my experience the first time around. My midwife came to my house for all of my appointments. And first of all, just to not have to drive anywhere for my appointment was amazing. And then it really did feel like I was having a conversation with a friend.
Yeah.
We're sitting on my couch, we're having a cup of coffee together,
Yeah.
maybe sharing some sort of snack or something. And she's not just asking me about, you know, have you had any swelling? Have you had any blurry vision? Are you dizzy? How's your nausea? Like have you had any contractions? Like we go over that stuff. But she's also like, how are you? How are your emotions? Like, has anything happened this week and that, could affect anything? And how you have a trip coming up? Like, let's talk about that. Like, she's getting, it's just like a whole nother level. So by
True.
the time you're ready to give birth, you feel like this person has become, part of your family.
For sure.
Like just like another person that you would want to be there regardless of the fact
Feel
that they can deliver
so
your baby.
Yes. You feel so known and seen
Yeah.
with a home birth midwife. Yeah. And there is something so intimate, isn't it, about this other woman coming into your home, on a monthly and then weekly basis. Like you said, she's drinking out of your coffee cup. She's eating your snacks. Like she's using your bathroom before she leaves to go to the next appointment. There's something so like communal and just beautiful about that kind of connection with your care provider. And like you said, she's not just your care provider, she becomes a friend and part of the family at that point. And so then when she's stepping into your home when you're in labor, she knows where everything is and she knows where the rooms are and she can kick off her shoes and it's just such an intimate experience for birth.
Yes. It really is. It feels safe and peaceful and that's another thing to point out is that when you hire a home birth midwife, and that's your care provider of choice, you know that that's the person who's going to be at your birth.
Right.
Like 99% chance. I mean, some
Less
crazy
of
emergency
emergency.
would
Yeah.
have to happen for them to not be there. And they always have a backup, of course, but um, when you hire that home birth midwife, that is who will be at your birth.
I
If you're
mean,
at a
people miss a birthday for to be at your birthday, you
right,
know?
she'll miss Christmas with her family to be at your birth. And as opposed to a birth center, even where they have, 3 to 5 or now 7 midwives there who are rotating and on call. So, again, while you know them better than you might know an OB, you still don't know who's going to be at your birth. Like, you
Right.
can't choose it, you can't pick it. You don't know which one you're going to get. And that would be the same for the
Mhm.
hospital as well. You really have no idea who's going to be on call. Now, every once in a while, there'll be, a care provider who says, well, I'll do a special for you. So let me know when you're in labor and I'll come in, even if I'm not on call. Like, they say that. And if you have like a long standing relationship with them
Right.
typically. Um, but it's just like it's just a different experience.
Another thing that's different about, birth center and hospital versus home birth is your home birth midwife is going to be bringing in an assistant with her. And it's most likely somebody that you've met and also made a relationship with. Whereas if you go to the birth center or hospital, you're going to have nurses that you've probably never met before. You probably will never see them again. And they're one I mean, there's some wonderful nurses, but they're just doing their job and they're on the
Ah, the shift.
shift. Your home birth assistant, your midwife assistant is also on call for you. And so, again, there's just something so beautiful about calling your birth team and them all coming to you instead of being somewhere waiting for you to come to them. I think there's something that's like so serving about that for us to come to you when you're ready for us. And you get to stay in your safe space. And really, when you think about home birth and just kind of like think about it as a whole and all the beautiful things that are involved in it. Isn't that what birth is supposed to be like? And historically, that's what birth probably looked a lot like before it became more modernized and medicalized in the hospital setting. I think that our ancestors, were probably used to having someone come to them when they were in labor instead of having to go to that person.
Yeah, that shift didn't really start taking place till like the 50s and 60s.
It's very
Like,
recent, very recent.
so
Yeah.
that, for all of humanity up until less than 100 years ago. um
Our births have been attended by people that we were in relationship with.
and in our homes.
Yeah.
Yeah. But the shift thing is a good point. So if you're in labor at the hospital or even the birth center, um, and there's a shift change, you get a whole new slew of people, a new care provider, a new midwife, a new OB, new nurse. Whereas if you are at home, you know that they could be there for 16, 15, however many hours with you, and they're not leaving.
Yeah.
Like, they're not going to leave just because it hits 12 hours and they're like, my shift is up. I'll see you
Exactly.
later.
If
Like,
they get sleepy, someone will take a nap while the other one stays up with you, and,
right.
they will eat in your home, and yeah,
Yeah.
it's very different.
Yeah. It's a different experience. Um, and then quickly, let's just talk about postpartum. So with
Yeah.
a hospital midwife or a hospital OB, your postpartum visit is like after you leave the hospital is 6 weeks later, and
Yeah.
that's it. One time, 6 weeks later, one and done, in and out. And 99% of the time, they're doing 2 things. They're checking on stitches if you had any, there and healing, and they're asking what kind of birth control you wanna be on.
And sometimes they'll do, like, a mental health assessment
Right,
thing,
postpartum
fill out.
depression screening. Yes, that's right. At the birth center, it's actually quite similar. You'll go back to the birth center like a day or 2 after the baby's born, but that's more so for stuff that would happen during a hospital stay. But then again, you don't go back until about 6 weeks later and you go to them. same type of appointment.
Mhm.
But for home birth midwives, they come and visit you multiple times throughout that 6 week period. They come a few days later, a couple weeks later, and 6 weeks later. Like, depending on the midwife, you could have anywhere from 3 to 5
Right.
postpartum visits. So it's just a different level of care.
Very different.
Um, and postpartum is something that gets kind of thrown to the wayside in our country. Like, once the baby comes, everyone's like, and you're done. Like,
Exactly.
finish, let's move on. So, but a home birth midwife will be able to attend to your needs a lot more postpartum than a birth center or a hospital midwife or OB would be able to.
Absolutely. And I do think breastfeeding rates would be higher in moms who gave birth in hospitals if they were being seen more postpartum than just 6 weeks.
Right. Because a lot of those struggles take place in those first 6 weeks.
Yeah,
And then it's like, then you get to your 6 week appointment and you're like, are you still breastfeeding?
right.
Nope.
Yeah, exactly.
Yeah.
And again, with the postpartum depression screening, I had a home birth with my second baby, and my midwife didn't come in and hand me a piece of paper to fill out. She asked me questions, very good questions, and she felt safe and I felt comfortable. And so if I had been struggling with something, I would have been much more willing to share that with her versus filling out a piece of paper that's being handed to someone. I don't know what they're going to do with it
Right.
and what that means for me. And then also speaking to the, multiple visits with a home birth midwife postpartum, my home birth midwife also did the 3 day, 2 week, and 6 week postpartum visit. But, at every single one, and even right after the birth, she said, I've already scheduled these meeting times out, but if you need me, you call me. Like, she won't say, "Well, you're having a problem. Let's just wait 2 more days until I'm supposed to see you," you know? She
Right.
will change her schedule around to come see you, and she wants to be helpful in that way and, um, assess how breastfeeding's going and how your healing's going and how you're doing in general. So, yeah, even in postpartum is such a different level of care with home birth.
Well, I'm sure we probably missed a couple things, but I think generally speaking, now most people will have an idea of what care providers are out there, what the differences are, what the differences in care are, why you might want to see one over another. But if we didn't answer all your questions, please let me know, and we'll be happy to cover them at another time. But Christian, thank you so much for coming on and talking about this with us. I really, really appreciate your knowledge and your professionalism and everything that you have to offer.
Thank you so much for letting me be part of it.
Thanks again for joining us today. Be sure not to miss an episode by hitting subscribe. Also, we'd love for you to leave a review of the show so that more people like you can hear more stories like these. If you're local to the Triad of North Carolina and seeking childbirth classes, birth consultations, or a birth doula, please click on the link in the show notes to take you to our website for more information. Just as a reminder, this show is not giving medical advice, so please continue to see your personal care provider as needs arise. Also, if you would like to be a guest on the Surrendered Birth Stories podcast, please click the link in the episode show notes to get in touch with me. We hope you have a great week, and remember, learn all that you can, make the best plans, and then leave it in God's hands.